How do we treat peripheral neuropathy that is due to diabetes? A question from one of our followers. Now, diabetes can affect the peripheral nerves, causing peripheral neuropathy. It usually happens later on in the disease process, especially if the sugar is not well controlled. However, in certain patients, it can happen early on. Now, diabetes can affect the sensory nerves and the motor nerves. If it affects the sensory nerves, can cause numbness and tingling sensation and burning pain. And if it affects the motor nerves, can produce weakness. Typically, it starts in the lower extremities and ascends and goes up to involve the upper extremities. There are two components to the treatment process, treating the symptoms and treating the disease. Regarding treating the symptoms, we use medications to suppress the pain. So usually we use Cymbalta, amitriptyline, nortriptyline, Lyrica, gabapentin. Those medications suppress the symptoms, especially pain. However, you have to continue using them to control the symptoms. Regarding treating the disease process itself, unfortunately, the damage that diabetes caused the nerves is irreversible. So we always tell patients, please control the sugar to prevent the disease from progressing. Now, there are some research and promising data that stem cell therapy can help the symptoms. However, this is in the early stages. Thank you.